My name is Dr. Amaal Starling. I'm an assistant professor of neurology at Mayo Clinic in Scottsdale, Arizona. Chronic migraine and episodic migraine are truly on a spectrum of disease. And so first of all, migraine is defined as a sensory processing disorder. I don't want to define it as only a headache because it's not just a headache. In fact, there are some people with migraine who don't even have head pain or headache whatsoever. However, most commonly, individuals with migraine will have some sort of head pain that is typically moderate to severe in intensity, typically worsened by any type of routine physical activity or movement. It can be on one side of the head or it can be on both. It can have a throbbing quality of pain. In addition, it could have a pressure or a tension-like type of pain. A lot of individuals will also have sensory sensitivities, so light will bother them, sound will bother them, smells will bother them, and then also some people will feel sick to their stomach, get nauseated, and even worse, some patients will actually vomit. So that's really kind of what defines migraine. And then episodic versus chronic migraine is truly defined as the frequency of the headache days. So in individuals that have less than 15 headache days per month, we call those individuals people that have episodic migraine. But when they have 15 or more headache days per month, with the majority of those headache days having migraine features, as we just discussed, that's when we diagnose someone with chronic migraine. And to fit the diagnostic criteria, they have to be in that pattern where they're having 15 or more headache days per month for at least 3 months. There are many risk factors that can predict the progression from episodic to chronic migraine. And the beautiful thing is a lot of those risk factors are actually things that we can modify. So things like obesity, snoring, a high frequency of headache attacks and poorly treated headache attacks. All those things are risk factors. Untreated depression and anxiety. Those things can all be risk factors for the chronification of migraine where it goes from episodic to chronic. So one major sign is that you're having more and more frequent migraine attacks. And so in individuals that are starting to have consistently 2 attacks per month and they're not yet on, 1 to 2 attacks per month and they're not yet on prevention, it's an important time to go and talk to your healthcare provider that you might need to start exploring preventive options so that you prevent having more and more frequent attacks. The brain has this maladaptive behavior where if you start having more attacks, it starts feeling like it's normal to have more and more pain and more migraine attacks, and that leads to that chronification. In addition, if you're finding that because you're having more attacks, you're using more as-needed medications, that is also a high risk factor, a prominent risk factor for the conversion and progression from episodic to chronic migraine. So you kind of keep your eyes on those different risk factors and you modify them the best way that you can. So if you have any untreated depression or anxiety, whether it's related to your pain condition or not, it's important to get that addressed separately. I always tell my patients, yes, I understand you have migraine and you also have depression and anxiety. I can't treat your migraine effectively unless we also treat your depression and anxiety. And whoever is treating your depression and anxiety can't treat that effectively unless I appropriately treat your migraine. So you have to treat both arms there. So that's a good way to try to prevent the progression. And prevention is key, right? That's always the best treatment, is preventing this. In addition, if you know that your sleep is not restorative and if you are aware from your sleep partner that you're snoring, to go and address that with your healthcare provider. To lead a healthy lifestyle, to make sure that you're able to get exercise and that you're watching what you eat so that you're not having an elevated body mass index. And then again, really keeping a good eye on the amount of medications that you use. And that doesn't just include prescription medications, but also over-the-counter medications. So things like Tylenol and ibuprofen and naproxen, all those medications, the higher frequency that using those medications and prescription as needed migraine treatment medications, those are all those risk factors for chronification. And if you can modify those things, you can prevent the progression from episodic to chronic.